we're going to learn how the parotid gland is related to the facial nerve. If you look at the lateral view of the face, this structure is the lower jaw, that is called the mandible, and this part that I'm feeling now is called the ramus of the mandible. This is the angle of the mandible. This is the lower border. Ramus of the mandible, I'll just draw this ramus of the mandible that I'm seeing like this, okay, and this will be the angle of the mandible, and this is the lower border, okay, this is the lower jaw, and this will be the condyloid process, and this will be the cornoid process of the mandible, okay. I'm just drawing this outline, and here you can see the external auditory canal, which I'll represent by over here. This is the external auditory canal, and behind this here you can palpate a bony prominence, and that is the mastoid process of the temporal bone. So I'll draw the mastoid process of the temporal bone over here. This is the mastoid process. Deep to that, you actually have a process called the styloid process of the temporal bone, but it's not palpable. So I'll just draw a styloid process over here and just let you know that it is a deeper structure, and it is not palpable from not usually palpable from the lateral side, but that is related to the styloid process, part of the temporal bone. So that is also related to the mastoid. Now from the mastoid, you actually have the sternocleidomastoid over here. This is the sternocleidomastoid, which is this muscle that you're seeing here. Why I said all this is because the parotid gland is actually located over here in this space behind the mandible and in front of the mastoid. Okay, that is a space that is filled with the parotid gland. We can see that in this model between the ramus of the mandible and the temporal bone, the styloid and the mastoid, there is a space that is filled with the parotid gland. And you can see that the parotid gland fills that space. Posteriorly, you have the mastoid and the styloid process, and it is resting on the masseter and the ramus of the mandible. If I take a section over here, I can draw like this. This is the right side. I'm taking a section. So this section will be the ramus of the mandible. Okay, this is the ramus of the mandible. Here you will be seeing the mastoid. This is the mastoid section, and this is the styloid section. Okay, I'm taking a section that goes like this. Okay, in this plane. So this is the ramus of the mandible. This is the mastoid process, and this is the styloid process. So let me just orient you with this compass. This is anterior. This is lateral. This is medial. And this is posterior. Over here you will have a muscle. Okay, this is the place where you have a muscle, and this muscle is the masseter. Masseter is you can palpate masseter when you clench your teeth. Okay, that is the masseter muscle. And from the mastoid you have the sternocleidomastoid. So here I'll show the sternocleidomastoid over here. Okay, that's the sternocleidomastoid, and this will be the posterior belly of the digastric. That is also related here. Posterior belly of digastric. And this is the place where you have the parotid. So I'll draw the section of the parotid to give you an idea. Okay, parotid will be something like this. Okay, it is filling that space, and it will be something like this. It is filling that space. It has a lateral surface. This is the lateral surface, which is found on the lateral side. Okay, that is the lateral surface. The part that you can feel, palpate, is the lateral surface. This will be the anteromedial surface, which is relatively concave. That is the anteromedial surface, and you can see that that is resting over the ramus of the mandible and the masseter muscle. Okay, here you also have the medial pterygoid muscle. This is the medial pterygoid that is also present here. So it is in contact with the masseter, with the ramus of the mandible posterior border, and the medial pterygoid. So that is the anteromedial surface. And this is the posteromedial surface. So let me just quickly refer with the squiggly arrows. This is the lateral surface or the superficial surface. This is the anteromedial. This is the anteromedial surface, and this will be the posteromedial surface. So the posteromedial surface will be facing the styloid apparatus, the mastoid apparatus, and the sternocleidomastoid and the posterior belly of digastric. The anteromedial surface is facing the masseter, the posterior ramus of the mandible, and the medial pterygoid. This is the medial border, and you can see that the medial border is much inside. Okay, it is actually near the lateral wall of the pharynx. Okay, the deeper part of the parotid is actually like that. So our main topic was facial nerve. So let us just have a look how facial nerve is coming. facial nerve is coming through the stylomastoid foramen, and that's why I actually drew the styloid process here and the mastoid. So between this, if you have a look at the inferior view of the base of the skull, between the styloid process and the mastoid process, you have a foramen, and that's called stylomastoid foramen. And through that stylomastoid foramen, the facial nerve will exit. Facial nerve will come down. We take the temporal bone, and if you look at its parts, you can see that between the mastoid process and the styloid process, you have, if you look at the base of the skull, you have a foramen, and that is called the stylomastoid foramen, and that is through which the facial nerve exits out. You know that the facial nerve runs through the petrous part of the temporal bone, but it exits out through the stylomastoid foramen. From there, it starts its extracranial course. It will descend down through the stylomastoid foramen, and that nerve, the facial nerve, will enter the parotid gland in the posteromedial surface. So let me just put this into space. It's something like this. This is the lateral surface. This is the anteromedial surface. This is the posteromedial surface. So the facial nerve that exits down, exits from the stylomastoid foramen, will enter the posteromedial surface, this surface. The posteromedial surface, it will enter into the substance of the parotid gland, and within the substance of the parotid gland, it will divide into a temporofacial and a cervicofacial. Temporo means this is the temple, cervical means neck. So a temporofacial trunk and a cervical facial trunk. So that trunk division occurs within the substance of the parotid gland. So let me use a yellow color, which is representing a nerve. The nerve is actually coming like this, and it is entering into the posteromedial surface, thus entering into the substance of the parotid gland, and there it divides into the temporofacial and cervicofacial trunks, and then it further divides to become the 5 branches that exits through the anteromedial surface. They exit through the anteromedial surface, and when you look from the lateral view, you feel that it is coming out from the anterior border. It is coming out actually through the anteromedial surface, and it runs over the facial muscles. And it is supplying, this facial nerve branches are supplying the muscles of facial expression. So the relationship of the parotid with the facial nerve is like this. The facial nerve exits through the stylomastoid foramen. It enters into the posteromedial surface. Within the substance of the parotid, it divides into temporofacial and cervicofacial trunks, and then it emerges from the anteromedial surface. And when you look from the lateral side, it is going just deep to the anterior border of the parotid gland. Okay, that is how facial nerve is coming out. Any surgery over the parotid, any lesions in the parotid, there is a risk of facial nerve being injured because facial nerve is going through the substance of the parotid. So this relation is very important. How it enters and how it leaves are also very important. Thank you.